Hi, today we're having a look at how to do a search strategy of articles using three different databases, Medline, CINAHL and SpeechBite. So the clinical scenario that I was looking at was a 70-year-old man and his daughter attend their first outpatient speech pathology assessment session. Charlie has been referred to you by a neurologist after being diagnosed with Parkinson's disease. Helen reports that Charlie's speech has become harder to understand recently, but Charlie is less aware of this. Neither is sure about why he is seeing a speech pathologist, as they've been told he is only going to get worse. Because of this, they believe that treatment to improve the clarity of his speech won't work. What will you recommend to Charlie and Helen? So the PICO elements that I identified in the scenario where the population is elderly men diagnosed with Parkinson's disease. The intervention is speech therapy. The comparison is no speech therapy, and the outcome is improved speech clarity. So the research question I developed using these PICO elements is, does speech therapy improve speech clarity for elderly men diagnosed with Parkinson's disease? So I've created a PICO table of search terms and search enhancers. So in the population part of the table, I came up with the terms of elderly and aged, men and adults. Can use a truncation of Parkinson with the star at the end, and that will bring up Parkinsonism, Parkinson's disease, and any related terms. Could also look at neurodegenerative disease, hypokinetic rigid syndrome and paralysis agitans, which are synonyms for Parkinson's disease. So the interventions, some different terms that could be used are speech therapy, speech pathology and speech language pathology. The comparison is no speech therapy, no speech pathology, no speech language pathology. And the outcomes, some of the terms that we could use are improved, increased and better, speech, communication, expressive language, and clarity, intelligibility and clear speech. So when we take those terms and go into the databases, okay, for the keyword, you can put in Parkinson's, Parkinson with the star, and press search. And we can click Parkinson's disease and Parkinson as the keyword. So that's our first search term. Then I'll put in speech therapy. I can't remember what my things were. What was the thing that I put in? Oh, intelligibility. So I can tick speech intelligibility, speech perception here. Okay, so now we want all three of those search terms to be in the article, so we select combining those with and then we come up with 26 papers. So that's a manageable number of papers to have a look at. So they're down here. So this article here is one that I've selected that I've had a look at because it's a review of level 2 papers. So I've had a look through all of these another time. Okay, so and selected some papers to have a look at. So going to Sinal. So similarly, looked at Parkinson's disease and speech therapy and intelligibility. Intelligibility. And when you put in those 3 terms, it comes up with 17 journal articles. So that's a manageable number to look through to see which ones meet our criteria. Also in SpeechBite, you can go to advanced search. Look at Parkinson's disease, speech pathology area. Looked at speech, and that covers all parts of speech. Type of intervention is speech therapy, speech articulation, phonological therapy within the degenerative disorders population, and the age group is adults. So when we search in this database, I got two papers. So when I had a look at these papers and ranked them, the best papers that I found were these here. So the first one was a systematic review of level 2 studies. So this was a great article which had a look at which speech and language therapies are effective compared with placebos or no intervention for speech and voice problems in patients with Parkinson's disease. And this is quite a recent study, and it was very thorough. This review by Pinto, this was also a systematic review, but it looked at level 2 and level 3 studies, so it wasn't as good wasn't as high level of evidence as the first review. But again, this was looking at research question that we were interested in, which therapies are effective in improving vocal loudness and speech intelligibility for Parkinson's disease patients. This paper by Ramig was a randomised controlled trial, so this was a level 2 study in 2001, and they were looking at does treatment with LSVT result in changes in sound pressure level in patients with Parkinson's disease. LSVT is an intensive voice treatment. This paper by Scott and Caird was from 1983, so it's quite an old paper, but this was a randomised controlled trial as well, so another level 2 journal article. And they looked at, the question that they were looking at was, does speech therapy result in improvements in prosody and intelligibility for Parkinson's disease patients? And then this paper by Lowett was a quasi-randomised trial. So this was a level 3 paper, and they looked at how do the long-term effects of traditional rate control therapy compare with altered auditory feedback on speaking rate and intelligibility in persons with Parkinson's disease. So these were the 5 highest ranked relevant studies to the clinical question that we were trying to address that I found. Okay, thank you.